If the joint replacement surgery has not been done, you can breathe a sign of relief, since its consequences are unpredictable. Even relatively young people may experience severe persistent pain, infections, and rejection of the prosthesis. But even with successful surgery, only about 40% of elderly patients return to their previous physical activity. Also, one should not think that the bones will heal if the grandmother or grandfather lie for several months. The chance of hip bone fusion in the elderly are negligible, and deadly complications from lying in old age appear very quickly. If you give large doses of vitamin D3, then calcium will be deposited not so much in the bones, but in the vessels and kidneys, exacerbating atherosclerosis and forming kidney stones. So, your task is to put a relative on a healthy foot as soon as possible in order to avoid deadly complications from immobility. No later than a week later, the patient should be sit up in bed, and no later than 2 weeks later, put on a healthy foot, on crutches, or on a walker, in extreme cases, on the dynamic standing frame, verticalizer. The first and most important thing at all stages is psychological help. There may be traumatic stress, unwillingness to live, the extinction of basic functions. By suggestion, by the conviction that all this will pass, that he or she will definitely have to go in 6 months, in a year, you should push the relative out of this state. Know that our body is not a mechanism. Our body is programmed by consciousness. And if a person has hope, the body will begin to work to recover. The body will try to create a new false joint, which in many cases will make it possible to walk, even with a walking stick. But do not tell the patient in many cases. Say, "You will walk for sure." Full confidence in recovery greatly enhances the body's defenses and works wonders. A person really starts to walk somehow. The first week, sometimes longer, there may be severe pain that will require the use of painkillers. Painkillers can significantly worsen the condition of an elderly person, cause vomiting, impaired functioning of the kidneys, liver, stomach. Therefore, they must be taken in minimal doses, and those that are better tolerated should be selected. Pain can be reduced by gentle massage throughout the leg and light circular movements in the fracture zone. You should immediately get an anti-bedsore mattress, otherwise bleeding bedsores will appear in a week. The most effective are air mattresses with continuous pumping into different sections. For example, the Italian Chinese Ricant C300. It is placed on a regular mattress. It is convenient to place it under the patient, reeling in a roll along the entire length. Compressor noise can be reduced by connecting long hoses, 5 meters each. Their inner diameter for a cant is 6 millimeters. They can be found in automotive parts stores. In addition to noise, the disadvantage of air mattresses is that they do not allow air to pass through. The patient may sweat, and they are not warm enough due to the continuous circulation of air inside. They are easy to cut through. There are foam mattresses against bedsores with a cover that allows air to pass through, but does not allow fluids to pass through. Only soft ones are good, according to their instructions, that can withstand up only to 120 kilograms, with longitudinal and transverse sections in foam rubber. The ideal option is to put an air mattress on a solid base, turn on the maximum pressure of the compressor, and put such a foam mattress on top. If the bed sores still appear, they will disappear in 5 days if they are sealed with a hydrocolloid patch, for example, Granuflex. Usually you have to use diapers for adults. They must be replaced every 8 or 10 hours and immediately after defecation. When removing the old diaper, it must not be pulled out. It will remove the skin to bed sores. The patient must be turned. When replacing a diaper, the patient lies on a healthy side, healthy leg straightened. The edge of the new diaper, which is without a clasp, is twisted and laid under the patient. In this case, the patient should be slightly turned on the stomach. Resting your hand on the pelvic bone. Then turn the patient on his back and slightly on the sore side, and untwist the edge of the diaper. Then turn the patient to a healthy side and lubricate the moistened areas of the buttocks with a cream containing zinc oxide, especially if they turned red. Disinfect your hands before use with alcohol or tincture of calendula. Then turn the patient on his back and drip a liquid baby cream that does not contain zinc oxide into the folds of skin between the legs, and grease a healthy side on which the patient has to lie almost constantly and which blushes on the best mattress. If a constant pain appears in the folds of the skin, then you need to apply a cream with antibiotics, for example, benzoin. You can release the cream directly from the tube into the folds of the skin. The edge of the diaper will then bring the cream into the depth. But it is better to first try to treat diaper rash with a cream containing propolis and calendula extract. The diet should be vegetable with dairy products. The amount of liquid drunk should be about 1.5 liters per day, taking into account the liquid in soups. A smaller amount of fluid drunk will provoke constipation, and a larger amount will overload the heart. The amount of dairy products, such as cottage cheese, should be about 1 liter per day, transferring from all milk amount used for cheese production. A huge danger is progressive constipation, leading to intestinal paralysis. It is necessary to monitor the number of defecations and, in case of constipation, apply a laxative or enema. The only natural laxative that can be used without addiction every day for many years is frangula bark, in Latin language frangular cortex. The dose is selected individually. 1, 2, sometimes even 3 teaspoons per glass of water. Boil for 15 minutes. If even the maximum dose does not help and constipation lasts more than 5 or 6 days, an enema should be given. It is not hard. The rubber enema should be sterilized with boiling water before each use. Boiled water for an enema should be slightly warm. The patient lies on a healthy side, bending his legs. Diaper is unfastened and turned under a healthy side so that it absorbs everything that is needed. An enema is introduced parallel to the spine, a few centimeters in depth, and is completely compressed. Usually enough 200 or 250 milliliters of water. In severe constipation, vegetable oil is poured instead of water. To prevent pneumonia and other complications, chest massage breathing and regular gymnastics should be performed. Read more about this in the addition under the video. It is very important to blow air through the tube into the water, and the depth of immersion of the tube into the water should be 10 centimeters. When doing massage, say that you are transmitting good energy, and it will be so. But most importantly, literally to save a life, put the patient on crutches or on walker as quickly as possible. Walker should be without wheels. And if the patient is very weak, you must use the verticalizer, the dynamic standing frame. How to use walkers? You will find the link in the addition under the video. And here we will consider the use of Tavegyl verticalizer. The fourth size Tavegyl is designed for growth from 110 to 170 centimeters, but in different years it was produced with a width of a chest cage from 32 to 37 centimeters. It is better when the width of the chest cage corresponds to the width of the chest of the patient. Then it is more convenient for him to lean on it like on crutches. And now, briefly, the most important things. No later than a week after the fracture, the patient should be sit up in bed, so that it does not cause pain. Get up on a healthy leg or crutches no later than 2 weeks later, or on a walker without wheels, or on the verticalizer, the dynamic standing frame. After a long lie, you must not sit up or stand without pressure on the veins. The legs should be bandaged with an elastic bandage. In the future, you need to regularly massage his legs, stroking lightly from the bottom up. If the patient is weak and cannot get up, it is necessary to raise the bed to a level where it will be easy for him to get up. It is necessary to get up on a healthy leg as often as possible and longer as possible. Massage of the fracture zone in a circular motion will accelerate the formation of a new false joint, which should allow walking. Any possibility of bringing the flu, infections, or respiratory diseases, viruses, must be ruled out. And remember, no matter what you believe, the Torah, the Gospel, or the Quran, always remember that the power of hot and sincere prayer to our Creator, our Savior, is very, very great. We wish you to successfully overcome all difficulties.